Good evening everyone. We are back with yet another episode of BMC Global Live AL-HILAL Health World, Nothing But Lifestyle. I am Anupama Menon. Health is not valued till sickness comes. In this talk show Health World, we have expert doctors from various fields providing valuable information to assist you on your journey towards good health. Today, we are delighted to have with us Dr. Jasmine Sankaranarayanan, the specialist gynecologist at Al-Hilal Hospital, Rifab. Dr. Jasmine comes with an experience of over 12 years in gynecology. Today's topic of discussion is ovarian cyst. So let's go over to her and know more about this issue. Welcome to the show and thank you for joining us, doctor.
Thank you.
So can we begin by explaining what exactly is ovarian cyst?
So to begin with, as we all know, we have every woman has born with 2 ovaries, okay, each on either side of the uterus, and these are quite small and the size of just an almond, okay, but it holds a very big function in a woman's life.
Okay.
So the function of an ovary is basically to produce eggs to prepare for the pregnancy. So every month during the childbearing period, a woman is the body is designed in a way to produce an egg, and this egg goes and fuses with the sperm to become a pregnancy.
Okay.
So basically an ovarian cyst is it is like fluid filled sacs, you can say, or pockets of fluid inside the ovary or on the surface of the ovary.
Okay. And what do you mean by functional ovarian cysts?
Okay, so what we will I would like to do is broadly classify the ovarian cysts into 3. Okay, one is the most common one, that is the functional cysts. Then we have the non-cancerous cysts, and then the third and the most unlikely or the rarest, you would say, is the cancerous cysts.
Okay.
So coming to the functional cysts, they are so called because they are due to the normal functioning of the ovary. Okay, so it's a part of the normal process of the function happening in the ovary, the menstrual cycle. The functional cysts are born in that way. So in a functional cyst, we have 2 types of cyst. That is the follicular cyst and the corpus luteal cyst.
Okay.
So the follicular cyst, we have to understand the menstrual cycle pattern for that. So that begins with the first day of the period. In a woman, from the first day of the period, if you count up to the 7th day, by the 7th day of the period, the ovary starts producing very, very small follicles. The immature follicles are formed in the ovary. So these are the precursors of the eggs that I spoke earlier about.
Okay.
For the pregnancy. So these immature follicles start releasing the important female hormones, that is the estrogen and the progesterone. These hormones will further help in the growth of the follicles. Finally, till by the mid-cycle, that is around the 14th day of the cycle, these eggs will become, the follicles mature, they become mature follicles, and one of the mature follicle is chosen to release an egg from it. It will rupture, release the egg. Now this egg will travel through the fallopian tube to reach the sperm in the uterus, in the cavity, and the sperm and egg will fuse together to become a pregnancy.
Okay.
So when the pregnancy is formed, what happens to that mature follicle that had ruptured? This follicle that has ruptured, it still has a role to play. It will form what is called the corpus luteum. So this corpus luteum will further grow in size and it will help in supporting the pregnancy, okay, because that will be still continuing to release the pregnancy hormones, estrogen and progesterone in sufficient amounts, so that the pregnancy grows further. Okay, but this corpus luteal cyst is a very short, a transient period only it will be there.
Okay.
It will be there for the first 3 months of pregnancy, beyond which the placenta will start forming and take up the role of the corpus luteal cyst.
Okay.
And the placenta will start supplying
So this dissolves or disintegrates or?
Exactly.
Okay.
So that is why it is called a functional cyst.
Functional cyst.
It does its function and it disappears.
Okay.
Okay.
So only
that is
during the
about
first 3
corpus
months
luteal
of
cyst.
pregnancy.
Exactly. But about the follicle, suppose the egg is not formed. There are conditions when there are hormonal imbalances and the egg is not released from the follicle. So what happens to this follicle? It just keeps on growing, and beyond 2 centimeter, if it keeps on growing and fluid gets collected in it, it becomes what you call the follicular cyst.
Okay.
Okay. But again, this is just being a functional cyst, and by the end of 2 or 3 months, when the next pattern, the next cycle becomes normal and an egg is released, this follicular cyst will disintegrate and this will also disappear.
Okay.
So that is about the functional cysts.
Okay. And doctor, so what are the general causes, what are the factors that lead to the formation of these kind of ovarian cysts?
Okay, there are certain women, usually ovarian cysts, the age group we see most ovarian cysts is the reproductive age group. So when a woman is in the childbearing age from 15 to 45 years, that is the common period when most of the ovarian cysts are found.
Okay.
But it's not that the other age groups are not affected. We also see it very rarely when a girl is less than 15 years of age, okay. And there is also, it's also seen rarely in women of the menopausal age group,
Okay.
that is beyond 50, 52. But the thing is, the non-cancerous cysts are seen in the younger age group, and if a woman is developing a cyst in the menopausal age group, there is a higher tendency for it to be a cancer.
Cancerous one. And what are the symptoms of ovarian cysts? How
Yeah,
does
yeah, and we needed to speak about the, you were asking about the risk factors, right?
Yes.
Yes, yes. So the higher risk group is, as I said, the corpus luteal cyst is seen in the pregnant women. So if you do an ultrasound for a pregnant lady, you can see that the corpus luteal cyst is mostly there.
Okay.
In the first 3 months this will be seen, and
But
many
that's
women,
not a cause for concern. I guess.
exactly.
Okay.
So that's what I want to stress, that so many women come to us with this ultrasound taken in the first 3 months. When they see the cyst, they are very concerned. But when you have repeated the ultrasound in the 5th month, the cyst
That's
has
gone,
disappeared. So that is one thing about pregnancy. Then women who have infertility or any other conditions where there is a hormone excess, hormone imbalance, these situations will result in ovarian cysts.
Okay.
And if a woman has had a severe pelvic infection, what can happen is that the fallopian tube and the ovary can stick together.
Okay.
Okay, there will be a plastering together and they become a cyst.
Okay.
So that is another condition where you can get cysts.
Okay. Coming back to my previous question, so if we can talk about the symptoms of ovarian cysts, what are the symptoms normally seen in women?
Yeah. Usually the problem with an ovarian cyst is it is totally asymptomatic in most of the women.
Okay.
Even if it's a cancerous cyst, most of the women come very late with symptoms. And the
Okay.
kind of symptoms they have are usually misleading. They will have something like nausea, bloating. They usually end up with a gastroenterologist or with a physician saying that they have this
Stomach
feeling
issues.
of fullness,
Okay.
yeah, fullness,
Okay.
acidity, bloating. So they, for a long time, they may be just prescribed some medicines, antacids and all to relieve their symptoms. But when they are noticed that the symptoms are not relieved with this, and then an ultrasound is done, that time this cyst may be picked up.
Okay.
So that is the non-specific symptoms. Some of them have no symptoms at all. Now, if the ovarian cyst is too large, it can cause some more symptoms. For example, she can have a sharp pain in the lower abdomen, a fullness in the abdomen. Then, if you know, one of the very dreaded complication of a large ovarian cyst is that it can twist.
Okay.
It can twist around its pedicle, resulting in a cutting of the blood supply to the ovary and to the cyst.
Okay.
So that can cause severe pain, nausea, vomiting, and that becomes a surgical emergency.
Okay.
Where she has to immediately come and has to be operated upon.
Okay. So basically the symptoms that we have to look out for is maybe bloating or nausea and
Yes,
some kind
yes.
of a pain,
Yeah.
right?
And even menstrual irregularities.
Menstrual irregularities. And is PCOD also a form of ovarian cyst?
I would say that it is not an ovarian cyst. What happens in PCOD? Everyone are very afraid of PCOD now because
Yes.
that is one of the commonest cause of concern now amongst the teenagers especially.
I guess
And,
because of the lifestyle and
yeah. That is mostly because of the lifestyle changes we are
changes.
facing nowadays. So this polycystic ovarian disease is not actually cyst, but it is like a group of immature follicles. That is because of the hormone imbalance. Our hormones are not able to act properly so that in every menstrual cycle a mature follicle is formed.
Okay.
So what happens is that an array of immature follicles form. So there is no production of egg, no release of egg. So there is the menstrual pattern gets irregular.
Okay.
She also develops some other conditions like obesity, facial hair growth,
excessive hair
and
growth
acne.
and- yeah.
These all situations will be associated with
Okay.
that.
And is it hereditary by any chance? Let's say your mom has ovarian cyst. Is the daughter more prone or likely to have it?
Usually no. These are because PCOD is something that has come up newly.
Okay.
Okay. And it is because of the lifestyle changes only.
Okay.
The fast foods and the sedentary activities, lifestyle. That is the most problem.
Okay. So with lifestyle changes, this can be prevented.
Yes, yes.
And doctor, other than functional cysts, are there any other kind of cysts that you're aware of?
When we come to, we have a wide variety that this endometrial tissue starts, swelling up with blood at the time of the menstrual cycle, the period. At the time of the period, it starts just swelling up and it will get collected with blood. So now, when it sticks on over there for a longer time, this blood gets altered, the color of blood will change, it becomes black colored. So that is why when you do a surgery and you see these black colored cysts, that's why it's otherwise called chocolate cysts.
Okay. Because of the color of the cyst.
But other than it's not very huge in size. That is another irony. It's not too huge in size, but the problem is because of the symptoms. Women get really concerned because they have too much symptom with this. Either there will be excessive bleeding, or there will be too much pain at the time of the periods. Maybe even with intermenstrual period there will be too much pain, and even pain at the time of intercourse. So that's why they usually come for treatment for this. The other kind of cyst I would like to discuss is a dermoid cyst. Now this is a very interesting kind of cyst. The thing is, dermoid cyst, it is usually seen maybe like genetically, and the specialty of the cyst is it is having a totipotential nature. For example, totipotent means it can grow any kind of cell in it. So when you have removed a dermoid cyst and you cut it open, what you see will shock you. You see hair inside, teeth inside, nails, teeth, hair, nails, because it can produce any kind of tissue inside it. So it is like something very magical kind of thing. And fortunately, it is not dangerous, it is not cancerous. The problem with a dermoid is because it is very heavy because of its fat content. So as I said earlier, it can twist. It can twist and cause severe pain and cut the blood supply to the ovary. So that's why it becomes, if it becomes huge, it becomes a surgical emergency and has to be operated immediately.
And removed, And how do you diagnose ovarian cyst?
So as I said, when there is, because most of the ovarian cysts are asymptomatic, and other than the functional cyst, we have to follow up every other cyst. More, more close follow-up is needed. So that is why even if a woman has no symptoms, it is very important that she comes to the gynecological clinic for a pelvic examination once in a while.
And this is starting from the age of from puberty onwards?
Yeah, not from puberty onwards. Like it's important that every woman is aware of her menstrual pattern, because that is a very clear indicator of something going wrong inside. So any woman with any menstrual irregularities or any vague abdominal pain, fullness, anything you feel, after the age of 20, 25, you can start visiting the gynecologist. So that will we'll be able to pick up very early changes, And so the examination, the clinical examination is the first and foremost thing, followed by an ultrasound. Ultrasound is very, very crucial in diagnosing ovarian cysts. So by ultrasound, we can understand, we'll be able to identify whether it's a functional cyst or a simple cyst, something non-cancerous, or whether there is any appearance of a malignancy. So the next step of testing, investigation will be tumor markers. So when I told you about the dermoid cyst, endometriotic cyst, each cyst is associated with a tumor marker. Especially any cancerous cysts are associated with some tumor markers, and if by seeing that particular cyst on ultrasound, the gynecologist, the radiologist and all can make out that approximately that this may be the kind of cyst it is. So based on that, we can do that specific tumor marker, and it can help in making our diagnosis more confirmatory. So that is the thing about the tumor markers. There are a battery of them. I'm not going into detail in this session. So we can choose, and the most common one done is CA125. So this is a tumor marker which we do. It's a blood test. We do it just to make sure whether if we are doubtful about the cyst being malignant or benign, it helps in corroborating our diagnosis. And then the next higher level of investigation will be doing a CT or MRI scan. So this is not done for all patients. For example, if you come across a functional cyst, you don't need to do a CT or MRI. But whenever you feel your diagnosis is not sure, you are suspicious of a malignancy, suspicious of a cancerous lesion, you can go ahead with a CT or MRI. Even in endometriotic cysts, as I said, there will be a lot of small tissues like this filling up with blood, and when this blood is released into the circulation, it causes plastering of the you know, the fallopian tube and the genital, the organs, the uterus and fallopian tubes together. So when you want to do planning a surgery for such cyst, you can do an MRI to know the extent of plastering and to know the feasibility of your operation.
Okay. So basically the first step would be an ultrasound scan and then tumor marker, and if you suspect anything more, then maybe an MRI or a CT scan. And doctor, for the benefit of our viewers, could you also you know, explain the various treatment options available? Is it controllable through medicines, or what are the options available for ovarian cyst?
Again, when we are coming to the treatment, we are dividing it into 3 categories. Okay. For the example, for the patients with functional cysts, we are usually following the wait and watch policy. So we will just see the size. So the treatment will depend on the size of the cyst, the type of the cyst, the age of the patient, and whether she is having children or not. That's also very important, because whenever a woman is in the childbearing age group, she is not conceived yet. She is, the main plan is to, you know, treat the infertility. So we will try as much as possible to avoid a surgery, because when we open and when we touch the ovaries, we are, you know, when the ovaries are manipulated, there is a high chance of reducing the ovarian reserve, and we can further, you know, compromise the fertility potential of that patient. So unless really necessary, we won't go for a surgery in such patients. But otherwise, for a functional cyst, especially if it is less than 5 centimeter, as I said, the size is important. If it is less than 5 centimeter, we will only wait and watch. You don't need to give any medicines, no treatment required. After 3 months, usually this disappears. So we will wait for 3 months and repeat the ultrasound. For her. And if it's disappeared, well and good. Now, if the size of the cyst, whichever cyst it is between 5 to 7 centimeter, that is the borderline size. So now at this point, we are like doubtful that it can grow further in size, and she may need a surgery for that. So, sorry. So what we do is we will start her on the medical management. The usual pills we are giving is the low dose oral contraceptive pills. Now when we are giving a pill from, we are supplementing her with these hormonal pills, we are, you know, making up for the hormonal excess or the imbalance that she is facing. We are by giving the pill from outside. So when that imbalance is, the balance is restored between the hormones, naturally most of these cysts can shrink, especially when it's a hormone induced cyst. So these can shrink in size over a period of 2 to 3 months. So again, our repeat ultrasound will be after 3 months to follow up the cyst. And many a time, these medical management is useful in shrinking these cysts, and we can thus help in, you know, avoiding a surgery. Other than the oral contraceptive pills, we are also using progesterone pills, and there is for endometriotic cysts. Now we have a very new. There is the latest one which we are preferring is the Diagnose pill. So that is supposed to be really helpful in shrinking and reducing the symptoms associated with the endometriotic cysts.
So like you mentioned, if the size is below 5 centimeter, it's very important that the patient goes for regular scanning to see that if it's grown in size or not. And 5 to 7, it can be controlled with the help of medicines. So as you said, surgery would be the last resort, right? But what is that deciding factor where you take that call to operate, surgically remove a cyst? And does that mean like a surgery? Does it mean you're just removing the cyst, or you're removing the ovaries as well, you know?
So as I said, the age of the patient and her whether she has children, whether she has completed a family is very important. So when it is a benign ovarian cyst, that is a non-cancerous ovarian cyst, always we are doing conservative surgeries only. Earlier we were just cutting open the abdomen totally and removing the cyst or the ovary, whatever. But now we have laparoscopy, the keyhole surgery has come up in a big way, and whichever all the non-cancerous cysts can be, even if they are large ones, we are able to successfully remove by laparoscopy. So even if it's a large fluid filled cyst, maybe it could be 10 centimeter, 15 centimeter, we can just put this, do the laparoscopy and, you know, drain out the fluid first and remove the whole sac, just like that, you know. So even large cysts can be removed by laparoscopy now. But when a woman is not had children, so we will try to restrict it only to removing the cyst, and we will keep the ovary intact. Even in PCOD we have surgeries. Sometimes we go for surgery when medically we are not able to, you know, make the patient conceive. Then as a last resort, we also go for a procedure called laparoscopic ovarian drilling,
Okay.
where we puncture these immature follicles and release the testosterone. The androgen production will be high in these immature follicles. Once that is released, the ovary becomes once more functionally active, and within 3 to 6 months we advise the patient to try and conceive.
Okay.
So those are the kind of surgeries we commonly do. Even in endometriotic cyst, we try to remove only the cyst.
Okay.
And even if we are not able to remove the cyst, at least we will make a puncture and drain out the toxic fluid inside. Okay. The only surgery where we need a proper full surgery we are doing, a definitive surgery, is for the cancer.
Cancerous ones.
Yeah, for the cancerous tumors, we can't just remove the cyst or the tumor. We have to go ahead and remove the ovary. Mostly we will be removing the other side ovary and the uterus also.
Okay, to ensure that doesn't spread anywhere
exactly.
else.
So that is for a definitive cancer. Now there are some suspicious cases where you are still doubtful. You have done the MRI, CT, everything you have done, but still you are doubtful that maybe this is a cancer. So, and it can be cancer of one ovary, and you want to know if it has spread to the other ovary.
One as well.
So what you will do is you can take a biopsy from the unaffected ovary and do a frozen section.
Okay.
Frozen section means on the spot, on the operation table itself, you can get the biopsy report within half an hour.
Okay.
And then based on that, you can decide whether you need to remove the other ovary.
Okay.
So these kind of procedures are preferred for a very young girl with a suspicious malignancy.
Okay. So doctor, before we wrap up, would you like to share any takeaway message for our viewers?
Yeah, so the most problematic thing about an ovarian cancer, unlike a cancer of the uterus, is that it does not show immediately. It shows up very late. So it is very important that at a very early age itself, a woman should visit her gynecologist. She should be very much aware of her body, about the changes happening in her body. What I mean is the menstrual cycle pattern. She should have a proper understanding of her periods and the regularity with which it comes, so that any subtle changes also she can pick up, and she can visit the doctor early and get herself examined.
Okay. Thank you so much, doctor, for taking the time out to be with us and for shedding light on this topic of ovarian cysts. Friends, I hope all of you found this session very informative and useful. So if you notice, especially to all our lady viewers, if you notice any changes in your menstrual cycle, or if you experience any gynecology related problems, please don't ignore it. Seek medical help. Feel free to visit Dr. Jasmine in AL-HILAL Hospital, Rifa. Don't forget to love yourself and your body. Stay healthy and stay happy. Till we meet again next time, this is Anupama signing off. Good night and take care.